For us. So let's bring in Governor Phil Murphy of New Jersey. He joins us now by the phone with the very latest. So good morning to you, Governor Murphy. Thanks for joining us and making the time this morning.
Thank you, Dan, for having me.
So we just heard about what exactly the president is unfolding, right? And the coronavirus task force, this three-phase approach to reopening the economy. It's a bit of a reversal, now leaving it up to you, the governors, as it should be, to decide when. So what do you think of phase process with what the president is saying? And when can New Jersey start to see that? Is it too early to tell?
Yeah, I think it is too early to tell, Dan. It was a good discussion we had yesterday. There was a video conference, and he and I spoke privately after it. Here's, I think, the sequence of events. I think it's undeniable what the order has to be. We have to break the back of the virus. That means everybody's got to continue to stay at home and stay away from each other. I know folks are getting stir crazy. I don't blame them, but we are making real progress. Secondly, you've got to have really large-scale testing ability in place, which we needed from day one as a country. We haven't had. We're going to need that. New Jersey's, I think we're fourth in the nation in terms of total tests, but we're not nearly where we need to be, and it needs to be rapid turnarounds so you can identify very quickly if there's a hot spot, and then you contact trace who did that person get in contact with, you quarantine them, et cetera. And then I think you could begin to reopen the economy. We'd love nothing more than to get this place back on its feet, but it's got to be in that order.
So do you fear that the president said some other states may reopen as soon as today? Do you fear that if that does happen, that some of those states would open and some of those residents could even travel to New Jersey?
It could. It could. That is a concern. It's a legitimate concern. We don't have walls around our border, which is why the testing, the broad scale. Rutgers, by the way, is working on an example of this saliva testing. Easy to submit your specimen, unlike the current testing, and quick turnaround in terms of positive or negative. That's the sort of scale we need so that we can identify, assuming we eliminate or virtually eliminate community spread within New Jersey, you don't want that coming through the back door again, as your question suggests. And if we had that kind of scale testing, we could identify that quickly.
Which brings me to my next question then, this coordinated effort between many states. Yesterday, you said schools will remain closed through May 15th. So do you anticipate, that schools will remain closed through the end of the year? When will that decision actually be made?
So when we say schools closed, obviously it's remote learning at least until May 15. We'd like another bite at that. I mean, I suppose we could have gone right to the end, but we learn a ton one day to the next. And May 15th, 4 weeks from today, we may be in a please God, I hope, in a very different and far better place. In which case, we may make a different decision at that point.
Governor Cuomo has been very adamant. Governor Cuomo has been very adamant about a coordinated effort for New York schools, but Mayor de Blasio already says New York City schools are closed. So can you explain the conversation about this multi-state approach and the confusion here for parents? Yeah,
I mean, I don't have any insight. You'll have to go to the other side of the Hudson for getting insight into the dynamic there. But in terms of the coordination between states, and I speak to the mayor all the time, obviously speak to the governor all the time. We established early this week, we formalized basically something that we had already been doing when we were closing our states. Andrew and I and others said, hey, wait a minute, let's put a formality around this. If we coordinated closing, let's make sure we coordinate as we reopen. Again, your question from earlier, we're all packed in here together. New Jersey's the densest state in America. This is the densest region in America. Let's do this together. I think that makes an enormous amount of sense.
I want to get to the situation that's unfolding within nursing homes. Andover, as you know, had a makeshift morgue where as many as 68 people died. Elizabeth, New Jersey, has 29 residents in one home dying. Park Ridge, 33 deaths. I know you're calling for investigations, but the larger question now, was enough done prior to protect the most vulnerable population here, calling in the National Guard or making sure they had enough supplies to deal with this, looking back on it now?
Listen, we're going to, all of us, do and I hope the country does, a 9/11 commission-like postmortem here. We have to. I promise you we'll do that in New Jersey. And long-term care facilities, including the 3 veterans homes we operate, where we did bring in the National Guard. Department of Defense has come in. Veterans Affairs have come in with surge nurses. This is tragic stuff. You've already got folks, they're in a nursing home or a long-term care facility to begin with for a reason, right? Before COVID-19 ever comes around. And then you add that to it, and you've got healthcare workers who are heroically in long-term care facilities families as in hospitals doing everything they can. This is a tragedy, and that story in Andover is not just a tragedy, it's outrageous, which is why I've asked the Attorney General to get in there. The feds are investigating. Our Department of Health is investigating. It's one thing to have vulnerable, blessed vulnerable patients, residents become exposed to a virus. It's another thing to mishandle that as an operator, and we can learn lessons on both fronts, but on the latter, we're going to investigate this aggressively.
Yeah, and it seemed like they had a low approval rating overall even before this pandemic began, so I'm glad you are investigating it there to keep everybody safe. I want to get to unemployment numbers. They're obviously staggering across the country, 20 million Americans filing for unemployment. We have seen issues for those who are freelancers, who are self-employed, trying to file for unemployment. Websites are crashing. They're not getting the return phone calls from staff. What are you doing to help these folks out? Is there enough staffing to keep up with the demand, which obviously wasn't expected when we headed into this in the first place?
The demand, Dan, is when I say multiples of any other previous period, I'm talking about multiples in the tens of multiples. This is an unprecedented surge of folks who are losing their jobs, and it is independent contractors, but it's all, the entire economy. We've never seen numbers like this before. Right. Our folks are doing the best they can, but I would be lying to you if I said that they were able to get all this resolved in a day or two. They're still digging out of a big backlog, and I know folks are frustrated. They're on the phone holding for a long time, or they're going on a website that is crashing. Just all I could say is this: we feel that pain. Please have patience. Know the folks on the other end are also suffering through this with a family issue or whatever it may be. I will say this unequivocally: no one will lose one penny of their unemployment benefit, including the $600 added dollars from the feds. So please have patience. We will absolutely get through everybody. It's gotten a lot better the past few days, but if you're still out there frustrated waiting, that's of no solace to you, and I accept that and understand it.
And last question, Governor. A big part of the economy is the Jersey Shore. I'm from New Jersey. I love the Jersey Shore. Any plan on closing or keeping beaches open this season? What is your determination here?
Dan, I would be the happiest guy in Jersey, if not in America, if we could have at least a new normal summer on the shore. Too early to tell. I could say this: the balance of April, I think, is going to be the toughest period we've got. The last week and the next couple. I think May will be a little bit, assuming we all stay home and keep distance, May will be a little bit better. I'm praying to God the warm weather will be able to slowly but surely get back on our feet, including on the shore.
Governor Murphy, I appreciate your time. We spoke to your wife yesterday about next week's big fundraiser, Jersey for Jersey, which we're airing here. I'm looking forward to that, and I hope you are feeling better. I know you had surgery recently, so we are all appreciative of you getting back on your feet and doing everything you can to keep everybody safe.
Thanks, Dan. She was very excited to talk to you and very excited about the big event next week.
Yeah, we're looking forward to airing it as well. All right, thank you, Governor, and stay safe to you and your family, okay?
Thanks, Dan. You too.
Take care.